Welcome to Metabolic Matters Podcast, where we embark on conversations with thought leaders, disruptors, change agents, and passionate souls. Together, we'll delve into what truly matters to them. And you'll learn how to metabolize this newfound wisdom so you can transform your own metabolic health. Now let's meet today's guest. Hi, everybody. I am incredibly excited about this conversation we're going to be having today. This woman is amazing. Her family is amazing. And you're all going to have your hearts blown wide open and your curiosity piqued for sure after this conversation. And I've known Dr. Dagmara Beine for several years now. We met over a conference somewhere years ago and connected right away. At that time, she wasn't even in the journey you're about to hear today, but just to meet this woman, the powerhouse that she is, the curiosity that she has, it is no accident that she is part of the MTIH tribe, that she is launching her brilliance into the world with a book. By the time you see this video, her book will be delivered into the world, and she and her family's story are going to be leaving a ripple for all of us for years to come. So, Dr. Dagmara, I'm so happy you're here today to have this conversation. Welcome.
Thank you for having me. And it just feels so surreal because when we met, you were signing your book.
Yeah. Oh, look at that.
Yeah.
Wow.
So that was like, I remember somebody saying to me, "That's Dr. Nasha Winters." And I was like, "Oh," and they're like, "We're going to try to sit with her at lunch." Okay, let's do it. And we did. And that's how we met. But that was your book signing. And so now it's been 5-7 years
Yeah.
later. The fact that we're talking about a book that I wrote is just, it's surreal. Yeah.
This book has been in you for a long time, wanting to come out, but you've added a few chapters in the last few years, and we may dig into all of that today. And so the theme today is a heavy theme, right? I mean, you and I were talking before the recording started that unless you are on this journey, you may not even want to open your ears or your eyes to the conversation we're about to hear. This concept of pediatric cancer crises. And so maybe start there. Let's start with sort of demystifying or destigmatizing the fear around this.
Yeah. I think it's really important for parents who are not on this journey to know how common it is. Because once you're in the journey, that's your world and it feels very common and you realize how common it is. But 46 kids are diagnosed every day in the US alone. There's more than 500,000 survivors in the US. So it is the number one cause of death by disease in children, which is not what I learned when I was in school. I mean, that just developed, and the rates of pediatric cancer are just skyrocketing.
Yeah.
And so I think it's very important to know that it's common and it's preventable. I think that's the key. And so if you are not on this journey, why is this conversation important? Because we're going to talk about what led to these diagnoses. And you can look at your child and think about and learn, what can I do to prevent cancer in my child? Because you can. And I think that's one of the biggest myths that are spread, is that, especially in pediatric cancer, it's just bad luck. I mean, what could have a toddler done? What could have an infant done? What could have a 12-year-old done? But we know, because we do the testing, we look at their terrain, we look at their lab work, we talk to the family, and we can put pieces together of this kind of bad puzzle of what created this diagnosis in the child.
This is huge. And, you know, what I think is so interesting here is you and your husband are both healthcare providers. You are no strangers to the healthcare world. You are both really vital, healthy, passionate individuals, always have been. You've raised kids in the same place. You're all big adventurers. You eat well, you do all the right things. So, talk to us about what took you from the emergency room, clinician that you are, into the bedside of the world of pediatric oncology. Give us a little insight into your story of why we're even having this conversation today.
Yeah, so Ryan and I had two beautiful kiddos, and we're both working in the emergency department at the time as physician assistants. And our then 3-year-old daughter, Zuza, started exhibiting some, very vague kind of symptoms that were poo pooed away by the pediatrician. It was like leg pains and loss of appetite and maybe getting sick more often. And it was actually like our gut feeling and our discomfort where we made them draw labs on her, which is crazy in this country that we don't do labs in the
On
pediatric
littles. Yeah,
population
yeah,
until
yeah.
we have no baselines. Um, and her labs came back a little wonky, but nothing weird that you couldn't maybe explain by like a recent cold. So it sort of dragged on for a couple months until our world sort of fell apart when we found out that I was taking a shower on a Tuesday at 2 p.m. when I got the phone call. Your daughter probably has leukemia. And my world, as most parents who hear this, just completely stopped and turned upside down. Um, just fear consumes you. I mean, like, my kid cancer? What do you mean? And then, like, fear consumes you, and then you get consumed by the oncology world, and treatment starts the next day. And you don't even understand or know what the diagnosis is. Neither do they, because it takes more than a day to figure out what the true diagnosis is. But just like every other family, because of that fear and lack of knowledge, we were inpatient that night and we started chemotherapy the next day,
Wow.
only to find out a week later, when all the biopsy results were back, that it wasn't ALL, it was in fact AML, and we were started for a week on the wrong chemotherapy. And this is more common than you would ever imagine. And so my book starts with stop, breathe, get a second opinion, get a third opinion. Sure, be admitted, start fluids,
Right.
support your child, get to know your team, but
Yes.
make sure this is the team you want to work with. Make sure you have the right diagnosis so that you can get a second and third opinion and then decide as a family, how do we want to approach this?
Oof.
99% of the time, there's no urgency, right? Of course, there'll always be a situation where there needs to be an emergent surgery or something, but 99% of the time, nothing will change in your child's prognosis if you wait, I mean, up to a month in most cases. And now I recommend preparing your child for treatment. And so I often, if I get lucky enough to have a family come to me before they've started treatment, which doesn't happen very often,
Mhm.
I am begging them, convincing them to stop, breathe, and let's prepare your child for what their body is about to go through, because that can also make a big difference in their journey.
Absolutely. And I really want the listeners to understand that at that time when Zuza was diagnosed, you were ER centric. You had a
Oh,
good lifestyle, but you were not an integrative practitioner, an
no.
alternative practitioner, a woo-woo doc of any kind, what would be perceived as woo-woo. And so when did you start to go, there's probably a little bit more that needs to be done here than just standard of care alone?
Yes. So my parents were little birdies in my ear,
Mhm.
always in my life. And so they were little birdies in my ear from the beginning of, and they wanted to be respectful because they assumed Ryan and I are in medicine. So we must know what we're doing. But
In
they were
some
like,
ways, that's worse because you were too
yes,
close to be,
yes,
yeah,
yes,
you need to be parents, not doctors. Yeah.
yes.
Yeah.
But they would say like, well, maybe there's some supplements that can help, or maybe, maybe there's something else we can do. But really for me, it was when Zuza started treatment, like all kids became malnourished right away. we put an NG tube in and we had to make a decision on what formula to put her on as a 3-year-old. And the presentation of which formulas I could choose from, um, I was very conventional. There was really nothing holistic about me at that time. Um, I knew that I didn't want her to have high fructose corn syrup and seed oils as her main nutrition. And so I think that was the big light bulb moment for me. Like, wait a second, I don't like maybe they know what chemo to use, but I don't think that they know what else to do for my daughter.
Yeah.
And so I went on a quest to try to find a book. It didn't
Mhm.
exist for kids. And then I went on a quest to find a practitioner, and I couldn't find anybody who specialized in integrative oncology care for peds. So really, my whole like mission in life became to become the practitioner that I needed when I was there 10 years ago, or to have a book, a guide to at least help me to know, because you can't really still Google, can my kid take vitamin D with this chemotherapy? Like that data just doesn't exist. Um,
And why
and then it
is
just,
why are there few practitioners willing to go across the integrated bridge for information about other supportive therapeutics, especially nutrition, foundational support for peds? Can you shed some light on why there's
yeah,
a deficit?
why integrative practitioners don't exist?
Yeah, yeah,
Yeah,
or
I mean,
research in this arena doesn't exist, or both.
no. I think the biggest part is the medical legal fear. So when you're an adult in the US, you get to choose if you want to pursue conventional treatment or how much conventional treatment you want to pursue. When you're a child in the United States under the age of 18, um, when you get diagnosed with cancer, you absolutely have to do what is considered standard of care protocol for that type of cancer. And so now being a practitioner, unless your heart's in it, unless you're living it, there's not a lot of motivation on practitioners' end of getting into this very kind of muddy area, because CPS does get involved, and in recommending for a parent to do supportive care when you're being told by oncology you can't do that, it just gets really sticky icky. And so I think a lot of practitioners just stick to adults,
Yeah,
and that's easy.
yeah.
And
Well,
it's
right.
sad.
It
It's
is.
really sad.
Yeah. Because in some ways, I mean, first I want to say CPS is Child Protective Services. And so this is a real thing. Both you and I have met a lot of families on
Yes.
this journey who've had the threat of their children taken away or their children actually taken away when they opted to do something either instead of or in addition to standard of care. And even Lynn, who's behind the scenes producer of our podcast, she and I spoke to a family at the Acres Regenerative Agricultural Conference this past winter, where we met. There's a well known kind of public story about an Amish family. And we met the uncle of this young woman who was whisked away to Mexico at her diagnosis. Even standard of care said there's nothing we can do for this young girl, but we have to do all the things anyway. And when the family refused, they threatened to take her, and the family basically smuggled her across the border. It became a huge, it became, I mean, federal government got involved, not just local government, but federal. And they basically hid her down there doing treatments until she was completely, I think she was down there 6 to 12 months away. And it's made international news. So I'm not, breaking HIPAA here. But basically, when she did come home, like the family had to go through this unbelievable multi-year process of having her labs tested regularly, lots of imaging, the whole bit, which is funny because we wish they would do that type of
Yeah.
imaging and lab draw. When they're here, they don't. They were
Mhm.
trying to do it to make a point that this young woman was going to die, was going to be dead any moment, that she'd made the wrong choice, that no evidence of disease
Right.
with no standard of care. And we're, gosh, now she herself is grown up, married, and I think has children now, or working towards it. Like, this is what I'm talking about, is like, it is a thing. And so that fear is real. But I
Yes.
think it's also interesting. You talk about the fear of the parent, like that, the world crashing down, that moment in your shower. But you also talk about the fear of the establishment.
Hmm.
And so when you're sandwiched between that, what is between those two layers is this child.
Hmm.
And so how can you, as a parent, a provider, even an advocate, um, a policymaker, or trying to influence policy, what maybe tips could you offer to help navigate those dark times, those moments where fear in the wild can be a good thing. It's a survival mechanism, but ongoing and never relenting fear actually has very deleterious effects. So could you speak to maybe some tips that you and your family and you and your patients and families have uh, realized over these past 6, 7 years?
Yeah. I think one thing that has helped me, and I talked about to my families, is just like really looking at your life at that moment, big picture. And I still do that when I get very overwhelmed. Zuza has a lab that comes back wonky, right? If you just step back and sort of look at your life instead of being in it,
Minutia, yeah.
yeah, you can, I think, give it a little space and breathe to know that it, it's happening for a reason. And people hate to hear that. I think it's really hard. But you get to decide how you're going to approach this journey. And that doesn't just mean you're going to get to decide if you're going to do an integrative approach or conventional or how much of what, but you get to decide in that moment what type of woman you're going to be, what type
Mm,
of mom you're going to be.
mm,
And your child, and I've learned this so much through,
mm,
they you there's no faking it. Your kids feel your energy. And so if you're panicked and if you're thinking in your head, my kid's going to die, my kid's going to die, not that those, yes, those fears are going to come up and that's okay. We're human. But if you can just step back and know, like, my child is looking at me, they can feel my energy. What can I do to make my energy just calm? It doesn't have to be fake positive, but just calm. And taking things literally, I don't even say day by day, moment by moment.
mm.
That's one of the things, just kind of slowing things down and knowing that, like, one bad lab doesn't mean anything, right?
Good.
I mean, I've
Context.
even learned through Zuza's journey that, I mean, there have been times where I've sobbed with you on the phone because she relapsed again. But then I made up stories around it. And so we have to stop making up stories, right? Our mind makes up so many stories of, like, well, relapse means badness or death, or no, it doesn't. It doesn't. It means something different for everybody. And so now it's really just, appreciating every single moment and knowing that even in the bad, like welcoming those feelings, breathing, like saying, hello, fear, like, welcome. It's okay for you to be here for a while. And it will dissipate easier than trying to, like,
Instead of resisting it, if you kind of welcome it, it might have
right.
a different. That makes sense.
Yeah. And just resisting, I resisted the fact that my daughter was diagnosed with cancer for a very long time. I
Yeah.
resisted. I felt like I was being kind of dragged through life.
Mhm.
And now I accept it.
Wow.
And it doesn't make it less of what it is, but I accept it. This is our journey and it's our journey for a reason. And it just feels like I'm actually able to walk through life instead of being dragged. And
That's
it's a
huge.
really hard concept to get through to new parents
Yeah.
who are newly diagnosed. And I get it. It took me years, like Zuza's given us lots of chances with lots of relapses to, like, try to get this right. And I feel like we're finally getting it right as a family. Um, but that's also been because we've done other things, like, we talked about Ryan did a ketamine therapy trip and, like, just lots of different types of therapies that have allowed us to stop using our mind, which makes up stories, and just start using our heart and, like, the present moment.
I love it. I love it. That's incredible, because I think what you spoke to is the importance of the whole family unit, not just the child going through this, but the mindset and the awareness of the parental units going through this, and the impact and the interaction with the siblings or the secondary, like your parents, like these are huge. It's not just the child going through this process. And so I appreciate that you spoke to just having the awareness of how you're reacting, because as much as your child may not articulate it or say it, that they feel it. We have plenty of research that shows, I mean, first of all, what's this research around a mother can like know something's happening with her child in the other room without even
Yes.
hearing it. Like this is well researched and characterized over and over. So if you are in a place of terror, it's going to be impossible to um, prevent your child from also falling into that pit. And maybe they don't know it intellectually, but their chemistry certainly does. And you
Yes.
and I have had this conversation, like watching the journey with you and your family, and you with so many parents that you've witnessed and experienced this of helping people check in with that and maintain some, like you said, not Pollyanna it away, not
Right.
like wishful think it away or magical think it away, but just to be aware. I mean, isn't that what life asks of us, is to just be present even in the intolerable?
Yeah, and there's even studies on, I think, ALL, pediatrics, like in their HPA access. And so, like, there are studies even out there showing that um, how all those hormones, right, all those stress hormones, that if we are spewing off too many of them too often, that actually affects a child's journey through their therapy.
Big time.
And I think it's the hardest part. It's, people often get overwhelmed with nutrition,
Yeah.
um, and maybe sometimes supplements, but those are, when you compare the emotional, spiritual aspect of being on a pediatric cancer journey, the rest is easy because you can tell somebody how to eat. You can tell somebody what supplements to take,
Right.
what therapies, but you really have to, as a mom, dad, you have to be able to be open to working on your fear and
Mm-hmm.
what's happening. And that's hard because essentially the whole family becomes your patient.
Big time.
Um, and oftentimes, there's almost always some kind of a discrepancy between mom wanting to do mostly integrative care, dad not believing in anything but what the doctor with the white coat in the big institution says. And so it just, all the reasons why there's not a lot of integrative pediatric
Exactly. You
because
just explained why right there in
yes.
itself, which is huge. Well, it's interesting because the other thing you've taught me, and I've worked with children with cancer, and I've worked with families with cancer, but I don't think I've ever been on as long of a journey, as deep and in depth as a journey, in you allowing me to bear witness to your process. And one of the things that strikes me the most, and this I want folks to really hear, because you are a healthcare provider who, this is not your first rodeo. And even with that, the amount of, I'm trying to think of the right word, I kind of just want to say bullshit,
Yeah.
that's been laid on you. And this is, again, not to be talked despairingly about standard of care, but the mindset, the ethos in which they are in, is all about the sky is falling, everything is doomsday, there's nothing positive. How many times, I could probably, I'm guessing 40 times, maybe more, just that I am aware of with you and this journey, where they've said she's going to be dead tomorrow, she's going to die no matter what, she's dead. Like I,
Yes.
so many times, or how many, like, she's got to take all these drugs, she's got to do it this way, it has to be done this way. And you steering that, this is two parents that are medically trained. Let's talk about this for a moment. Let's talk about the statistics, the naysayers, the fear mongers, the negative nennies. How did or should or can one navigate this? And maybe give an example or two of what I'm talking about here if people have no clue what it is I'm speaking of.
Yeah, so unfortunately, the culture of pediatric oncology, conventional pediatric oncology. And I see this in the way that the residents and the fellows are taught, because they are taught this culture is to always think the worst, to always make sure that you tell the family all the worst, to not give hope, and make sure that you always review all the terrible things that could happen, but never the opposite of that. And that has never stopped. So when Zuza was diagnosed, as soon as we found out it was AML and she had a mutation that put her into a worse prognosis, we were told that she has to have a bone marrow transplant to make it more than a year. And something inside of me, so this was my first experience with my intuition screaming at me in my
Mm-hmm.
life, and screamed no. And but I thought maybe it's fear, and I think it's really hard to differentiate between your intuition and fear sometimes.
Yeah. Yeah.
um, but I followed that intuition, and ultimately, after doing my research and listening to myself, Ryan and I decided not to do a bone marrow transplant on Zuza when she was 3.5 years old. We were told she would relapse within a year, and we only did chemotherapy, and slowly, that long ago, started incorporating integrative
Yeah.
stuff, I would call it. I didn't really know what I was doing then, but I was doing what I could. And Zuza was in remission for 5 years.
Yeah.
That's the longest remission she's ever had.
Yeah.
Um, so that's one example. And another is just recently, before this third bone marrow transplant, when we were trying to get her into remission, she ended up having lots of complications, probably the most sick she's ever been. She ended up having a fungal lung infection, and GI bleeds. And it was like my example of what most kids go through when they first go through treatment. And I feel like everything we've been able to do with Zuza has prevented me seeing any of this until now, right? Her body's tired. I mean, she's had so many toxic therapies. But they would literally say things during rounds like, well, if this lung infection doesn't go away, we might have to cut her lung out. And they would just say it like nonchalant, or I mean laughable, like to the point where it's hard not to snicker, just because I do have some medical knowledge, but a parent who doesn't,
Mm.
oh my gosh. Or they would say, well,
Wave crashing over you. Yeah.
or they said one night, they said to us, her lung infection is so close to these vessels that at any moment, like, she could just die. And then you have to make a decision of if you want us to continue to work on her to be alive. Or and what, like, and of course none of those things happened. And they normally don't, but maybe sometimes they do when you're not supporting your child through this journey. Because I have, not only is Zuza incredibly supported while we're doing treatment, which is what every child deserves, but in in the middle of what her relapses were, we did everything to heal her body. And I think that is the reason why she has been able to take more treatment, right?
Yeah. Yeah. And treatments that everyone said you don't get more than one bone marrow transplant. She's now had three. You don't come back from that weird liver thing she had back in the day. You would never
Yes, she
think
had
she'd had it.
terrible DOD. Now she had something called TMA, which is like super rare, and most kiddos don't do well. And we're like being discharged home with it. And our labs yesterday pretty much show us that it's gone. Like, but it's not because she's lucky. It's
Right. It has
because
nothing to do with luck. Mom's working her
we
butt off. Dad's
we
working her butt off.
yes, I mean, it hasn't been easy for her because she not only has conventional treatment, but then she has all the integrative stuff she has to do. And for a kid, that's not always fun, right? Being poked with needles for mistletoe isn't always fun. Getting extra high dose vitamin C infusions isn't always fun. But at least now, being almost a 13-year-old, I think she sees, she reminds me now, Mom, I need my red light for my mouth, or Mom, she
Love
she
it.
knows. Yeah.
And what I think is extraordinary and what we're getting to come to here in just a moment is you started out our conversation today saying, I went into this deep dive because there was not a me to support me on this journey. So I had to become that person for myself and eventually for others. And that is what this book is about to do. It's about to just be an offering to the world around us of, here are some tools, some tricks, some comments, some like hope chest making moments to put out there, that there's more that can be done with standard of care, that you are more powerful than you've been led to believe, that there are tools to support, there's ways to ask questions and be engaged and not just be, hit by the tsunami wave of the negative ninnies, and that this is never ever going to get better and stuff. Like, you created a navigation tool and a
Yes.
resource
So this book,
to work
any
with.
parent can pick up, and they can, it's a guide. And it takes a caregiver from the moment you're diagnosed all the way through after conventional treatment is done, because you are not done, right? That is another terrible myth. Um, how to heal your child and your family after, what imaging and what labs and what integrative tests we need after. How do we continue to make sure that your child's terrain is clean, and that the child is thriving after? But a parent could literally pick up the book and go to the chapter of where their child is at. So if you're in treatment, you can literally go to the chapter where it talks about side effects from chemo, side effects from radiation, and what can I do that's less toxic for this side effect. We think about, chemotherapy is toxic, radiation is toxic. Yes, they're toxic. They're sometimes needed, but there's
Designed.
such a better way of doing them. There is a better way to make these therapies less toxic and more effective. And I do believe that when we approach that, not only are we decreasing the side effects during treatment, but I do believe we're decreasing the chance of late effects later on in life, which 95% of kiddos who go through treatment have a life threatening late effect by the time they're like 45 years old. The average age of pediatric cancer is, I think, 6 years old. So by the time they're 45, many of these survivors have congestive heart failure or secondary cancers. And I really think that we can prevent that. So I don't think we're just helping patients by protecting and supporting them through treatment. I think we're really making a change in the fact that 95% of kids who go through treatment end up having secondary cancers, life threatening diseases, congestive heart failures. We're making a really big impact, not just in their current life, but what they deserve, which is the rest of their life and a quality of life. So I break down every single type of the top 10 most common cancers, which are different from adult cancers. We don't talk about Wilms tumor. We don't really, like rhabdomyosarcomas and osteosarcoma. They're in the adult world, but they're not top. And I kind of talk about what is the best approach I've seen, or what are some of the things that have stood out for me. For example, mistletoe for osteosarcoma, right? The amazing study that shows if you've relapsed in osteosarcoma, had surgery, and clean margins, um, they took half the kiddos and gave them chemo etoposide, and the other half gave them mistletoe. And 10 years later, the chemotherapy arm had 0% survivors, and the mistletoe therapy arm had 56%.
Amazing. Amazing.
Mistletoe is an affordable, non toxic therapy. And so parents can just kind of like use the book just as a guide. It's not something I would love for them to read the whole thing, but it's something that they can literally open up when they're stressed and say, my kid's having diarrhea,
What can
or
I do?
my kid's having constipation. Do I have to give them Miralax? No,
Please no,
no,
please.
please
Yeah.
don't.
Yeah.
Yeah.
Huge. Well, like, this would be a really good opportunity. So if you knew then what you know now, let's maybe hit on the three major topics and maybe give us a few pearls from each of these sections to entice people in to read more, learn more, empower themselves more. So let's start with number one, prevention. What what might you offer your past self in supporting your family ahead of time?
Yeah. So I can look back on our life and really put together what I think are the big pieces of the puzzle that helped contribute to Zuza's diagnosis. And it starts with a young woman who wanted to get pregnant, who had a couple of miscarriages and was handed Clomid by her OB like candy, not knowing that there's some hidden studies that show that Clomid increases your chance of your child's leukemia by 50%. So it really like it starts with what you're doing as
Yeah.
a mom.
Preconception,
Yeah.
even. Yeah.
Yes. It starts with how well you're taking care of yourself. And if you're not, like if you're watching this and you've just like not taking good care of yourself, you can change that. You can detox. You can do all these really beautiful things before you get pregnant. And then how much pregnancy affects your baby. We know that kids born now, there's an average of 200 toxins in their umbilical cord. So kids are born toxic. And then I kind of write about in the book about a different idea of a perfect home. So in
Mhm.
our culture, a perfect home has a beautiful lawn, a white picket fence and everything new inside. And I talk about how toxic is your perfect home. So
Mhm.
we moved into our perfect home behind a cornfield. And so Zuza had an extreme amount of glyphosate exposure from a baby. And I know this contributed to her diagnosis. So really thinking about now, not just what you're eating and what you're putting on your body, but also the environment that you're surrounding yourself with. You definitely don't want to move and live on a golf course. You don't want to move into a brand new home because of the
Mm.
toxins of everything, and you don't want to keep a pretty lawn because those are all terrible toxins like glyphosate that I believe are one of the bigger contributors to pediatric cancer right now. So that's kind of where I go with prevention is anything you are putting on you, in
Mm.
you, on you, or surrounding yourself with,
Yeah.
you
Reevaluate.
really
Yeah.
better do your research,
I
right?
love it. Basically start doing audits on yourself. What's in your cupboards, what's in your fridge, your freezer, what's in your garage, what's part of your HOA. Start
Yes.
to know what you're being exposed to. You can check what's in your water supply, your
Mhm.
air, what you're living around. And you do a beautiful job in resourcing that for folks to understand and maybe bring awareness to things they might not have known because there's never any fault here. This is the other piece. Maybe before we move into treatment phase and survivorship, maybe speak to that because you and I have also come across this uh, with folks too that there's a some people take it that we're blaming the
Yes, I get a
pregnant.
lot of messages on like on social media of parents who I think don't realize that I am on this journey, but just think that I'm a practitioner, that I'm blaming parents. And this has nothing to or sometimes I'll share my story and I'll get messages that say, "Oh, honey, it's not your fault." Like I'm blaming myself. No, this isn't about blame. This is about knowing better because every single parent whose child gets diagnosed was doing the best that they could and wanted the best and is incredibly in love with their child. But once you know better, you can do better. So this is education. I had no idea that rugs have the highest amount of formaldehyde. Like, don't bring rugs into your home. I had no idea that I could find so many toxins in baby clothes. So I have to either not buy them new or like triple wash them and soak them. So it's just not even just not having the knowledge. But once you do, you can do better. So this is, yes, the book talks about all the different ways that toxins come into our life. And then we give resources of all the things that you could do better, all the way from like where to find the best flooring and drywall to like baby food. Yeah.
I love it. I love it. And so maybe a couple pearls or insights around treatment phase. Maybe give us an
Yeah.
idea of what that part of the book might reveal.
Yeah. So I had in my daughter, she is my greatest teacher. I had this very big contrast of seeing my daughter go through chemotherapy when she really wasn't supported, right? That when we were first diagnosed, maybe I got some fish oil in her, maybe some things I read, but she really went through chemotherapy initially, what I would refer to as unsupported, and had every side effect, every infectious disease, mucositis, diarrhea. She was not well. And then when she relapsed 5 years later, and I did everything I knew, and I was in the course, or had just
Yeah.
taken your
I
course. I mean, it
just
was like,
yeah.
it was
Yeah, you were
just,
really into it, I think. Yeah.
yeah. And so when we put Zuza into a deep therapeutic ketosis on her chemotherapy days, when we used, the things that we knew with that chemotherapy, the vitamin D's, the high vitamin A's, the L-glutamine, all the different things. I mean, she had no side effects.
And they were worried about that. Like, the
They
doctors
were,
were shocked that she had no side effects.
yes. In fact, during her first transplant, when I went into her first transplant so prepared, and you were really with me through that first transplant.
Most definitely.
And I remember refusing a proton pump inhibitor, and a transplant doctor that I very much so respect and really like came in the room and yelled at me, telling me she's going to get mucositis because of you. And and she didn't get mucositis because of me, because we
Yeah.
we actually figured out with Zuza this like incredible formula that I have now used not just on Zuza, but all my transplant patients, and none of them get mucositis. You can avoid mucositis through transplant. And you would think that this third time getting through, that there would be some curiosity, but there is none. There is no like, what are you doing? Why isn't she getting
Why
mucositis?
is this kid
So
a miracle on miracle on miracle on miracle on miracle on miracle on miracle? Because she
yeah.
is.
Yeah. So your child doesn't have to suffer. This journey is hard enough, and there are such easy tools through treatment that you can use. And we're not talking about wonky, crazy things. We're not talking about dragging them to IV clinics. We're
No.
talking about really simple things you can do in the hospital through nutrition and some key supplements that can prevent most of the side effects, and organ injury for your child. And that is everything, because who wants your child to suffer in an already, hard
Organized.
situation? Yeah.
I love it. And then you alluded to a lot about this kind of the long game and the survivorship and the number of survive 500,000, I think you said right now,
Yes.
survivors of pediatric
Yes.
oncology. And, as someone else, so I would be considered a pediatric survivor. I was 19 at my diagnosis, and that's like the cutoff in
Yeah.
that zone. And even without standard of care, I have sequela because of the lymphedema and all these things. So even when you don't go hardcore, you end up with lifelong patterns. But when you've had things that are by design to damage DNA and to destroy things, it takes the good parts of you along for the ride. And so there's a bit of a more of an uphill climb. And I think that you do a beautiful job in this book about talking about what needs to happen next in the survivorship piece. Like, after that bell is rung, it's just beginning, it's not finishing.
Yes. So there's just this really terrible mm, idea spread through conventional oncology that when your treatment is done and you ring the bell and they get their family together, and then like that you're done. And if parents only understood, if you thought your child was sick at the day of diagnosis, yes, the biopsy may be negative or the scan may be clear, but your child after conventional treatment is more sick than they've ever been in their life. And, just the idea of the fact that we talk about having to heal somebody's gut after they take a course of an antibiotic. Now imagine what their gut looks like after. It is not just ever chemotherapy. It's almost always antibiotics, chemotherapy, steroids, antifungals, antivirals. I mean, all of it. And so when you don't have a healthy gut, when you have a leaky gut, nothing's going to function. You're not going to absorb nutrients. I mean, there's a gut everything connection, gut brain, gut skin, gut everything. So that's a big, I write a whole chapter about like, how do we gut heal? And it's years, right?
Yeah.
It's years that it
I-
takes. And
yeah. Yeah.
many times for children like Souza, who've been through a bone marrow transplant, it, ultimately our goal with Zuza again is, yes, we'll gut heal for a long time, but she probably will end up needing a fecal transplant.
Yeah.
which is ultimately what I think, when your gut is really destroyed, is was what a child needs. I ended up, they love me at our hospital. They ended up
A
giving
little tongue in cheek.
I in one of these journeys, one of these years, she popped up positive for C. diff, and they wanted to put her on Flagyl, and I was like, "I'm doing a fecal transplant." They're like, "You're doing what?" So I ordered the
Remember that.
product. It was shipped to the hospital. They just, like, didn't even know what to do with me because they couldn't really tell me no, but they were super freaked out. And literally the next day, her C. diff was negative.
Yeah.
And
I
she didn't.
remember that journey because she was so destroyed in her head. The symptoms were so terrible.
Yes.
That was one of those dark moments.
Yes.
And you, again, you speak to this place of instinct and
Yes.
intuition, which is so critical. Even if you don't have a medical background, there's still something you going, I know there's
Yes.
something different. I know there's something better. I know there's something different. And you went for it. And this kid, like it, incredible how
Yes.
quick. I mean, it probably shocked you. I know it
Yeah.
shocked me.
Oh, it shocked me.
Quick.
Yes.
Like, oh, well, that was a happy accident of how amazingly fast we knew it would help
Yes.
like that. And the fact, again, what blows my mind is that none of them have said, holy schmoly, that was amazing. What was that?
Yeah.
Because
No.
there actually is so much data now
So
about fecal
much.
transplants and C.
Yes.
difficile and, ulcerative colitis and all
Yes.
these things. Like, you didn't do something woo woo and esoteric. You did something very evidence informed and now evidence based because there
Yes.
have been good studies since then. But dang, girl, like the size of your ovaries astonish me.
Well,
Um,
they've had time to grow, and now they're, yeah. Now, like, it's necessary. I wish I could take every scared parent and just, like, convince them you are your child's advocate. And you're right. I love that you said that. You don't. Yes, does it help me that, like, I'm a practitioner and I'm taking care of Zuza? Of course it does now. But 10 years ago now, almost, when I knew I didn't want her to have a bone marrow transplant, that wasn't medical. That was my mom intuition. And then I went to Google the research. Like, does my mom intuition make sense? Is there any data supporting that, like, she shouldn't have one? There
mhm.
was a little bit, right? Like, that's all I needed. Um, yes, you need to listen to your intuition, like that mom gut, that dad gut. Like, it is so strong, and there's been so many times on Zuza's journey where I'm like, they need to stop this medicine. And they're like, no, this medicine's supposed to run for 21 days. If we stop it, her liver thing's going to come back. I'm like, I remember it was Ryan's turn to sleep over, and it was like 5 in the morning. And I, like, called him. I'm like, you need to tell them to stop the medicine, And of course, he's the one there. Like, he's like, what? I'm like, you just have to tell him to stop. I just know it because her liver enzymes were going through the roof. We stopped it, everything. Yeah. So intuition is so important. And I'm still using my intuition to make the best decisions I can for my daughter. And I still have a hard time sometimes differentiating between fear and intuition. Um, but yes, we got off track. Healing your gut, detoxifying. So that's just such, like, a fun word now, and everybody's trying to sell some kind of a detox drink. That's not what we mean. I teach parents all the different ways that are how beautiful our body is and all the different ways that it does this on its own, right? Our skin, our liver, our kidneys, our lymph. But when you've gone through treatment, a lot of the skin, the liver, the kidneys, they just need a little bit of help and support. And it doesn't have to be hardcore. And in fact, it should be gentle, especially on kids. So we talk about sauna, and we talk about binders, and we talk about rebounding, and we talk about grounding, and we talk about nature, um, because that's what's going to help your child eventually be able to thrive. And then the last part, which is the hardest, which we touched on in the beginning, is healing as a family. The hardest time, and I thought this was just us, but it's every family. The hardest time is when you come home, you're done with treatment, and the first 6 months of being home, because the world is celebrating. You're getting all this really crappy cake and flowers from your
Yeah.
neighbors, and you're told your child is fine now. You can go on with your life, but something inside feels very wrong because the truth is, things will never be normal again. I refer to it as a beautiful shattering. you shatter as a family, and now it's up to you how you're going to put it back together. And it's okay for all of you not to be okay through that. And you need to communicate that. You need to find different types of therapies, and they're going to be different for the sibling, for the child who was on the cancer journey and still is, for yourself, for your husband. Um, and that's the hardest part. But I think the most important, because coming home and continuing to be in the environment that the cancer developed in, and pretending that things are normal often leads back to relapse.
Oh, I'm so grateful that you shared that truth bomb, because that is in fact what it is that but it's a tender one,
Yeah.
and it's one that deserves really, really deep attention. And so I appreciate that so much. So first of all, tell us the title of this beautiful book and where can people find it?
Yes. So it's A Parent's Guide to Childhood Cancer, and it's out May 16th, and they can find it at Chelsea Green, which is the publisher, but also at Amazon.
I love
And
it.
they can pre-order, but I think by the time this comes out, they'll be able to order the book.
And my understanding is you also have kind of a do-it-yourself program for parents, for families on this journey. You want to tell us a little bit about that?
Starting in June, so 2024, there will be, through my website, which is zuzasway.com, a course and a community that I will be building to be more accessible to more families, with like monthly webinars, and a course that they can take that just gets in depth into some areas that maybe the book didn't. Yeah.
Into the nuances. And then hopefully, knock on something wooden, in the not so distant future, you are also developing a course for clinicians to bring some
Yes.
courage to that environment, to say, I'm telling you, first of all, kiddos are so easy because
Yes.
we are so resilient. It's the family dynamic that's sometimes the hardest, but giving the confidence and the tools to navigate this, because we need a heck of a lot more people. You can't do this alone, and the world needs you. So I'm excited that's on the horizon as well.
Yes, and the book is, I think also great for clinicians,
I agree.
because I'm actually, when I look at it, I'm like, how
I
did I
know,
do that?
right? Decade of your, I mean, it's, you guys, it's amazing. I got
It's
to be
really
an
in depth.
early reader of this. It is like, I can't believe how much information. This
Yes.
is not light and fluffy. In fact,
Yeah.
I was like, there were moments like, are you ready to give this to the whole world? And you are. And it is important because it needs to bring everybody to the table all at once. And you've done that beautifully. Dagmara, what would be final words that you'd like to share with
Yeah.
this community?
I think it's important for everybody to know that on this journey, and what, like, the big message of the book, and my message is, it's not selling a cure.
Hmm.
It's letting you know that there is a better way. Your child, we can't, I think Susan's the perfect example of that. That, she has relapsed multiple times. And we have found ourselves in situations where we have decided to use conventional treatments that are toxic. But through it all, she has had a better way. She's been able to have an opportunity to have a healthy enough body to be able to withstand more treatment. So for some kids, this book will support a cure.
Yeah.
And for other kids, it will support just a better way, less suffering, just a better way through. I think that's the most important message.
Mm. I am so grateful for you. I am so grateful for Azusa. She is all of our teacher. And this book is her
Yeah.
teaching all of us. And so thank you so much. And can't wait to see how this unfolds.
Thank you for having me.
Thank you for joining us for this episode of Metabolic Matters. We hope you found today's conversation insightful and empowering. As we wrap up today's episode, we want to take a moment to acknowledge the incredible team and supporters who make this podcast possible. First, We'd like to thank our production team, Alex Sanchez, Cindy Kennedy, Jessica Gilman, and Lynn Hughes, for their hard work behind the scenes. Our theme song was written by Julie Newmark and performed by Whiskey Flower. And finally, we want to thank you, our listeners, for tuning in and being a part of the Metabolic Matters community. Do you want to learn more? Please visit our website, metabolicmatters.org, and you can follow us on Instagram. If you liked this episode, please leave us a review and share it with your friends and family. And if you want to help support our mission, spreading awareness and knowledge about metabolic health, reach out. We'd love you to join with us. Also, don't forget to subscribe to our channel and hit the notification bell to stay updated on upcoming episodes. We have so much exciting content coming your way. Until next time, stay curious, stay empowered, and remember, your metabolic health matters.